So if you're living paycheck to paycheck, getting a bill you weren't expecting can break the budget. That's what many of you have been seeing when you go to the doctor, an unexpected bill. Amy's investigating these new charges, and she's made some pretty big discoveries. Good morning.
Yeah, what we've discovered are unexpected, unexplained fees that are driving up the cost of doctor visits for families across Houston. And we're talking hundreds of dollars in charges above your copay, what you normally expect to pay. These are called facility fees, and patients are told days or weeks after their appointments that they have to pay up.
It's absolutely outrageous.
Outrageous new charges that Mindy Easterbrook has never been charged when she takes her 2 children with type 1 diabetes to see their doctor.
They see an amazing doctor there. We absolutely love her, but we're getting charged facility fees now by Texas Children's Hospital on top of our regular doctor fees that were being billed.
Right here in black and white, $405 for what's labeled observation treatment room and $290 that reads room, staff, and supply charge. And this isn't just an annual visit. Easterbrook's daughter and son check in with their doctor quarterly.
For these facility fees, you don't get a choice. You can't opt out. You don't know what the money's going towards.
Mary Beth Garino has studied facility fees as a healthcare advocate for the U.S. Public Interest Research Group Education Fund, or PIRG for short. She says facility fees are common at hospitals where patients are billed separately for doctors, specialists, and room charges. But in recent years, as hospital systems buy up doctors' offices, they are adding these facility fees to regular doctor bills. Texas Children's Hospital told me it began adding the fees to its doctor's offices that it considers hospital-based clinics on November 1st.
Right now, these outpatient departments that hospitals own are licensed under the same number as the hospital. And so that's how they kind of get away with using, it's a hospital location, even though the location might actually be, 10 miles away from the actual campus of the hospital.
Other viewers have sent us their bills. This one shows a $200 facility fee. In this case, Blue Cross Blue Shield paid $74, leaving the patient paying $126 above their copay. While the chatter is largely from Texas Children's patients locally, other hospitals here and across the country are charging the same fees. 15 states have passed laws limiting facility fees in some way, but only Connecticut has banned facility fees for any non-emergency outpatient care. And federal lawmakers are currently working on the Lower Costs, More Transparency Act. If passed, it would end facility fees outside of traditional hospitals. Until then, patients like Hunter, Sky, and their mom are stuck paying them.
Our kids come first, and I have to have them seen.
Patients cannot be on the hook for these extra charges, especially when they're already struggling to pay and delaying care because they're afraid of the cost.
All right, so what can you do? We do know that many patients have had those facility fees waived as a one-time courtesy when they called the Texas Children's Hospital billing department. A TCH spokesperson also told me that telehealth visits and urgent care visits will not incur facility fees. You can't really do telehealth for all types of appointments.
Sure. We
confirmed that Memorial Hermann Methodist and MD Anderson all charge these same fees for visits when patients are not in a hospital for outpatient doctor visits. And the Texas Hospital Association reached out late yesterday, and a spokesperson told me by email that without these fees, they say more than 80% of Texas hospitals would have to cut staff and services.
Interesting.
Yeah, so we know the Senate's also considering a similar bill, and if that happens at the federal level, it would mean that they would ban these across the whole country. So we're just kind of waiting for that catch up.
Okay, is there any idea if those fees are covered by insurance, though, at some point? I mean, obviously, they paid some of it, right? And the
Yes.
portion of it for the one person.
And so it really depends on your plan, but Texas Children's also pointed out in a conversation that the reason that so many people are seeing these now, when they started the fees November 1st, is that you haven't met your deductible. And so until you meet your deductible, for most plans, you're hit with that entire facility fee. But they're like, oh, don't worry. Once you pay down your deductible, for some people that's $1,500, some people it's $2,000. Then your insurance company may, pay all of it.
And those families weren't expecting, though, to hit that deductible so quickly either.
Right, exactly.
Money for interesting. Okay, yeah. Amy, thank you. That's a really good one.